Hello, welcome back to our previous ERMP exam question discussion. Case number 11. A 41-year-old male involved in a motor vehicle accident was brought to the emergency OPD. His GCS was 7 out of 15. Non-enhanced CT finding was unremarkable. What is the next best step in the evaluation of this patient? A. MRI without contrast. B. MRI with contrast. C. Contrast-enhanced CT. D. CT angiography. CT of the head remains the preferred imaging test for the initial evaluation of acute traumatic brain injury because it's fast and it readily identifies abnormalities that require urgent medical attention or surgical intervention. A negative head CT effectively rules out an injury that needs surgical intervention. On the other hand, MRI's superior soft tissue contrast makes it better for detecting diffuse types of brain injuries, such as contusions, which are non-hemorrhagic lesions. Diffuse axonal injuries, which are hemorrhagic lesions. MRI is also better for detecting any secondary effects of trauma, such as edema and hypoxic ischemic encephalopathy, and for detecting frontal lobe, temporal lobe, and brainstem injuries. Always consider diffuse axonal injury in patients with trauma with depressed level of consciousness. Patients who have sustained diffuse axonal injury usually present with prolonged unconsciousness, coma, or profound morbidity without overt focal brain lesion. Diffuse axonal injury is a severe form of traumatic brain injury that occurs when the brain experiences a rapid shift within the skull, often as a result of a violent blow or jolt to the head. This injury can cause extensive shearing of the axons. The damage from diffuse axonal injury can lead to significant neurological impairments, including coma or long-term cognitive and functional disabilities. The most common causes of diffuse axonal injury are motor vehicle accidents, falls, sports injuries, and violence. Symptoms of diffuse axonal injury can vary widely, but often include loss of consciousness, persistent vegetative state, and changes in behavior or cognitive function. Diagnosis typically involves imaging techniques such as MRI, which can reveal characteristic features of several small regions of susceptibility artifact typically seen at the gray-white matter junction in the corpus callosum. In more severe cases, they can be seen in brainstem. These regions of susceptibility artifact are surrounded by flare hyperintensity. Unfortunately, little can be done for patients with diffuse axonal injury other than providing supportive care, trying to minimize secondary damage caused by cerebral edema, hypoxia, seizures, etc. Management involves the early recognition and treatment of neurosurgical complications, such as herniation and hydrocephalus. Depending on the severity and distribution of injury, patients can vary from minimally affected to be in a persistent vegetative state. The amount of axonal injury in the brainstem is predictive of long-term vegetative state, whereas supratentorial injury can result in focal neurological or neuropsychiatric deficits. Now let's evaluate the options from the given case. A. MRI without contrast. We have seen an MRI as the study of choice in the subacute or chronic phase of closed head injury, with new or persistent cognitive and/or neurologic deficits, not explained by CT. An MRI without contrast is often utilized when seeking to identify subtle brain injuries, such as diffuse axonal injury, which may not be evident on a CT scan. Therefore, this is the appropriate answer. B. An MRI with contrast, on the other hand, could be more beneficial if there is a suspicion of an infectious or inflammatory process, or if certain types of tumors are a consideration, as the contrast helps to delineate such pathologies more clearly. However, given the acute setting of trauma without any indication of infection or tumor, contrast may not be immediately necessary. C. A study found no incremental information from contrast-enhanced CT scans in the acute phase of head injury. A contrast-enhanced CT could be useful if there was suspicion of vascular injury, as the contrast would help to visualize the blood vessels and identify any possible disruptions or blockages. DCT angiography is a more specific type of contrast-enhanced CT that provides a detailed view of the blood vessels in the brain, which could be crucial if there is a concern for vascular damage, such as dissection or aneurysm, that could result from the trauma, or in patients with coagulopathies who are on warfarin, for example.